Okay, hello everyone. Thank you very much for coming today. For those of you who are football fans and missing one of the best weeks of football before the playoffs, especially, thank you for coming out. I'm missing a few key games myself. So the forum today is the fight to rebuild and improve public health care. And I think that the idea of rebuilding and improving should be emphasized here. Doug Ford, obviously, in order to meet the sort of budgetary promises he made, he's going to have to attack the public sector. And so I think we can think in terms of, four fronts of struggle that are really going to be, clear in the coming years under the Ford administration. We've seen one of them, and that is he's going to attack minimum wage workers. I think we can anticipate that he's going to attack education workers. I think we can assume that he's going to come after transit workers, and I think he's going to come after healthcare providers, and that latter group is the one that we're here to talk about today. Now, this causes a lot of challenges for us, but it also opens up potential opportunities. Attacking the healthcare sector actually could prove to be quite a contradictory process for Ford, given how committed people are to public health care, and given that a lot of his own base will feel that way, and it'll be on us to take the initiative to try to turn that base against him when he does try to launch this attack and attacks on others. And this is why I think that it's crucial to emphasize that aspect of we're talking about today, the rebuilding and improving. It can't simply be defensive struggles against these attacks, right? We can't just defend the status quo. We have to admit that there have been profound cuts to public services for a long time, and that this has resulted in declines in the quality of the services that have nothing to do with the workers who are providing them. And so if we're going to go beyond mere defensive postures, if we're actually going to be able to galvanize the kind of public support for campaigns that want to protect these services, we also have to put on the agenda the question of rebuilding and improving them. And if public sector workers are going to lead some kind of resistance to Ford's agenda, to Ford's attacks, then there has to be ways of reaching out to the broader public, of representing the common good that public services embody. And that means we're going to have to be more ambitious. We have to think about improving the quality of services on the bargaining table, right? Saying that the working conditions of public sector workers are also the conditions for user groups who depend on those services to one degree or another, but often depend on them a lot. And so this is one of the things that I think we need to start talking about, and frankly, we're in a bit of a dire situation. Given that there's already been a whole host of cuts to public services since the Mike Harris era, I think we can anticipate that if Ford's going to try and keep his budgetary promises, the potential attacks coming on public services are probably going to be worse than what Harris had in mind. And yet, during the Harris years, we had a more or less immediate response from the labor movement. We had incredibly innovative and inspiring ideas coming out of the Days of Action, something that the world noticed. And if you look at the labor movement today, yes, there are a few shining examples of people who are organizing, who have already been organizing for a long time, but it doesn't seem like the level of organizing, the level of mobilizing, the level of preparation for what's coming is adequate. So we have to ask ourselves, where is the labor movement today? What's it going to do? Are we going to wait for the attacks to begin? Because, well, for some people, they've already begun. And for the rest, waiting till they begin is probably too late. We need to start organizing now. And that means we need to start walking into our unions, into our workplaces, having difficult conversations with our coworkers and asking them, what are we doing? What are we doing in our union? Are we having these kinds of political conversations? Are we doing the kind of workplace organizing training, the kind of political education, the kind of coalition building necessary to actually be able to resist these attacks that are going to come? Are we inviting workers from other sectors into our locals to talk about their issues? Are we doing the same? We're talking about ways in which we can bridge these struggles, increase our numbers, which ultimately is the source of our strength. And so I'm really excited about the event today. I think we have really excellent speakers to speak to these issues and more. The first is Natalie Mera. She's the Executive Director of the Ontario Health Coalition. And, this is one of the legacies, I think, of the Days of Action and something that we need to reflect upon. Natalie, take it away. Thank you.
So Paul talked about, are we going to wait for the attacks to come? And I was thinking about that, and actually, they're already upon us with the Ford government. But also, we have to bear in mind that we came off of 12 straight years of austerity under the Liberal government as well. And so we have been under very, very serious attack for a number of years. And so I just thought it would be useful to go back maybe to the NDP government in Ontario and just sort of run through very quickly where we're at. Can you hear me okay? Yeah. And then sort of move from there. So if we start in 1990, there was an NDP government in Ontario, and there were profound changes made to the health system. They tried to move care out of hospitals to the community. This was seen as a progressive notion, challenging the kind of medical model and the very conservative approach and the hierarchical approach of the hospitals, moving care to the more democratic, it was thought, community sector, which is dominated by not-for-profits, but not publicly owned and operated, actually. They spent the entire time of their mandate consulting on home care reform, and they really wimped out because the not-for-profits opposed making a public home care system at the time, and they didn't really pass the legislation to reform home care and create a public home care system, which was the eventual position that they landed on until the last year of their mandate. It was passed into law, but it never received royal assent, and so there were never any regulations brought under the Act, and it was never brought into force. In long-term care, they tried to systematize the kind of ad hoc long-term care sector, that's nursing homes I'm talking about, that were in existence. They were kind of not very institutional. They were smaller. They were like ma and pa shops, a lot of them. A number of them private, for-profit, but as I say, small, kind of like, owned by a retired nurse or those sorts of things. The chains really hadn't moved in at that time. And for-profit privatization of hospitals really hadn't happened at that time. So that was the NDP period. So they brought in a system of laws so that they could move more people to long-term care homes and to home care. They created a vision of home care, which was that people should be able to age in place and tried to expand home care. They brought in a new Home Care Act, but they were afraid to go to a fully public home care system. They did not challenge the existing for-profit long-term care homes, and they did downsize the hospitals quite significantly. Then the Harris government was elected in 1995, and they stayed in government until 2003. And the weaknesses of the NDP government became apparent when the Harris government came in. So they, because the NDP government hadn't brought in a public home care system, there were supposed to be 83, I think it was, multi-service agencies regionally around the province, which could have actually been built to provide home care and then also an array of social services and so on, and be like a community hub for healthcare. Since they didn't actually bring those in, home care stayed with the not-for-profits largely at the time, and it was very open to the Harris government coming in, and they brought in home care privatization. So they brought in competitive bidding on home care. They opened it up to contracting and tendering. The for-profits came in, and now the for-profits control about 80% of the home care market in Ontario. That's in terms of long-term care. The Harris government expanded the for-profit sector. By the end of the Harris government, the for-profits own the majority of the long-term care sector, about 60% now. private for profit, and they engaged in massive restructuring in the hospital sector, downsizing and restructuring. They ordered, I think, 49 hospitals closed, 63 amalgamated or merged, and so on. And then they tried to privatize clinical services, so MRIs and CTs initially, but we stopped them mainly on that front. And they tried to bring in P3 hospitals, so what they call public-private partnerships, which are just a form of privatization. And we slowed them down dramatically on that. They weren't actually able to get any through before they lost government, but they started the contracts in Brampton and Ottawa. So 2003, the Liberals come to power. I forgot what time I started.
You've got plenty of time. You got 15 minutes at least.
Okay. I don't want to belabor this too much, so I'm just racing through the history. But so the Liberals came to power in 2003, and they continued with almost all of the Harris government policies. The truth is they didn't really have a plan for whether to undo hospital restructuring or not. They kind of waffled. Well, they had a progressive finance minister, Greg Sorbera. They brought in the healthcare tax. It was impossible for the progressive side to support it because it was less progressive than the income tax, so it was less indexed than the income tax. So we had to fight to get it indexed to at least the same indexation of the income tax. We achieved that, but it meant that the progressive side was kind of silent on this tax increase that we desperately needed. By the end of the Harris year, I should say we were, in today's dollars, minus $15 billion per year because of the tax cuts, right? Because of the tax cuts that they brought in. So that was how the Liberals started. So they started by a tax increase. That was hard to support because it wasn't as progressive as the existing tax system was. And then in 2006, Greg Sorbera had to resign as finance minister in a scandal. They brought in Dwight Duncan as finance minister from Windsor, and he was an uber right-winger, and so he brought in corporate tax cuts, which now amount to about $6 billion in lost revenue a year. So, and then austerity in order to essentially pay for the corporate tax cuts. So they moved forward very slowly on opening some more long-term care beds, that's nursing home beds. The vast majority of those went to private for-profit companies. They continued with competitive bidding and home care until we stopped it after several mass rallies of several thousand people. They continued the downsizing, from 2003 to 2006, they increased capacity in public hospitals, and then they started downsizing and relentlessly downsized the public hospitals ever since. And then under Deb Matthews as health minister, they tried to privatize the diagnostics and surgeries and other clinical services. They continued with the P3 privatization. So essentially continued, albeit by a different method, but with very much the same policies as the Harris government. Now we have the Ford government, which we see as more aggressive. Certainly there's a broader opposition to the Ford government, but it's yet to be seen, whether their policies are, that much different than what we really have seen straight through from 1995. So in the face of this, the Health Coalition, our vision of organizing was that we weren't content to just make it look like we were doing something. We wanted to organize to win, and that we would measure whether or not we're, moving the ball down the field, since it's a football day, as we go along. And you see around you a lot of kind of social movements or activist groups and the labor movement that does a lot of organizing to make it look like they're doing something without actually worrying about whether they're changing policy. And we didn't want to do that. The other thing was that we knew that we had to be strong enough that politicians would actually have to pay attention, that we would actually have some power. And so to do that, we decided to organize in a multi-tiered way. And so you're talking about the sort of theme of this is about going on to the offensive. And I want to talk about organizing, because I don't think you can go on the offensive in terms of policy without actually building strong enough movements to win anything. So we built a multi-tiered organization with a central board of directors that is about a third labor, a third large community groups, and that actually represent patients and seniors and so on, and a third representatives of local health coalitions. And we built a network of local health coalitions across the province. When they're good and active and so on, we have about 80 of them across Ontario. And every year we meet in an assembly and we forge an action plan together. It's a democratic process. It's discussed and debated, and that becomes our action plan for the year. So that's how the coalition works. And we figured out that if we don't actually make a fight against privatization, the default is that we lose, because it's happening steadily, no matter who's in power, all the time. And so we had to make privatization visible, and we had to make a fight over it. That's central to the coalition, and it informs our politics, and it makes us a little bit different, I think, than some of the groups that exist. So anti-privatization is central. But also, fighting health restructuring and creating democratic debate and discussion about policy changes in healthcare that affect the healthcare system and access to care for everyone. And so we've spent the last, decade, 12 years fighting cuts to local hospitals in particular, because they're the target. They are the largest public not-for-profit part of healthcare, so they are the target for cuts and privatization, the major target for them. And fighting to protect small and rural hospitals across the province from closure, fighting to improve care standards in long-term care, and so on. And we have had very significant wins in those types of fights. We have saved the hospital in Wallaceburg, Ontario, in southeastern Ontario. We saved the hospital in Welland just recently. We stopped the closure of the birthing units in Leamington and Brockville. We stopped the amalgamations, the forced amalgamations of the Lindsay and Peterborough Hospital just this week. We stopped other mergers. We saved the thoracic cancer surgery in Windsor. We forced the reopening of 60 beds in Windsor and so on. So all around the province we work town by town by town, saving services and pushing back a bit against restructuring and cuts and so on. But most of those fights are defensive fights. So even if we, for example, we fought the P3 privatization of the hospitals, the new hospitals, and mounted a massive campaign, held referendi, volunteer-led referendums in communities across the province that were facing P3 privatization of their new hospitals. We opened the voting stations. We organized the community to run the referendum and also participate in the referendum. And then we had sort of luminaries in the community, judges and lawyers and mayors and MPPs and so on, counting all the ballots. And overall, we had, I think, over 180,000 people vote against the P3 privatization of their hospitals. And we were able through that to roll back the privatization, the scope of the deals, so that, for example, in the first two P3 deals that were pushed through, in Brampton, for example, there were about 400 jobs that were privatized. All of the service workers, the porters, patient records, security, everyone except for the nurses and doctors were privatized and bound into the real estate deal for the new hospital for the next 27 years for that deal, right? In the new P3 deals, all of the P3 deals after the first two, they did not bundle the services into the privatization. So we saved, they have maybe a handful of jobs. That the shell maintenance, like the HVAC people and so on, there's less than 10 of them probably privatized, and that's it in the deals. So significant rollback of the scope of the privatization, but still the P3s have continued. So we agreed that we needed to move to the offensive. We needed to push not only an agenda of saving local services, stopping cuts and stopping privatization, but also of pushing for the expansion, the restoration of services, the reinvestment, particularly in public hospitals that have been so dramatically cut, and improvements to care in long-term care, and also an agenda of progressive reform. So democratizing, for example, our public hospitals and the regional sort of level of governance, the local health integration networks, reforming patient access to care, patient access to information, within the hospital system, a whole bunch of sort of democratic reforms, improvements in care functions, improvements in moving money to actually the front lines, and so on. And that has been what we've tried to move forward with. So I'm just trying to be quick, and I can get into more details about the types of ways of organizing. But leading into this year, our agenda has been to pair the demand of stopping cuts and privatization with restoring and rebuilding and expanding public health care services and reforming them in the public interest. So we held a mass rally in October, the first one under the Ford government, under that mantra, with a list of demands that were for expansion of healthcare as well as the defensive fight. And over the last 2 years, we have achieved significant reinvestment in the hospitals, a reopening of 1,200 hospital beds under the Liberals in the last year of their mandate. They knew they had to answer to our campaign on hospital cuts and overcrowding and so on. And so they started to move with a real dollar reinvestment. And now under the Ford government, who have really spent, since they got into office, their time trying to manufacture a fiscal crisis so that they can, break their election promises and soften up the public for cuts and privatization and so on, force them to deviate far from their message and just announce $90 million more and another 1,100 hospital beds to be opened. So we are, even under the Ford government, pushing them to restore and rebuild services within the public not-for-profit hospitals. And in terms of the organizing for that, we asked the unions if they would come up with targets, the three of the big healthcare unions, if they would come up with targets for the number of members that they could bring out to the rally. So CUPE said, 1,000 to 2,000 people. Unifor agreed to bring out 1,000. OPSU agreed to bring out 1,000, and we said we would match with 2,000 from the community at least. And then we worked with our local coalitions and our networks, and the unions worked with their locals to bring people out. And we got about, I would say, 5,000. The police said 8. Oh, I'll take that, but I think it was more like 5. And what was interesting was that many of them were hospital workers from the unions. Most of them had never come to a rally before. The ones from Unifor, 3/4 at least. The ones from OPSU were the health professionals, 3/4 had never been to a rally before. And about 1/3, I would say, of the CUPE contingent had never been to a rally before. So that it was good new organizing on the labor side, and within the community also good new organizing. About half the people had never been to a rally before. And so now we've challenged our networks to come up to double that number. So a 15,000 person rally in the spring. And the idea is to both, Ralph Klein, when he was Premier of Alberta, he talked about healthcare as the electric third rail of Canadian politics, which I always loved, because I was like, yeah. So, in the railway, there's the 2 rails that the cars go on, and in the middle, there's the electrified third rail, and if you touch it, you get electrocuted. Well, and so politicians would be afraid to touch public health care because of the public reaction. And I like that. I figure our job was to electrify the third rail. Like, let's make them terrified to privatize healthcare, which they are, largely because of us, right? Because of the organizing that happens here and across the country. But more than that, we also have to capture the agenda. You can't win unless you actually have a program of progressive reform, what that looks like, what you're demanding, and so on. And a model of organizing that builds. And so we've challenged people to double the numbers for the spring, and we built a whole action plan around building and deepening our capacity, educating our members to do organizing in their communities, educating around some of the policy issues like taxation and fiscal policy that really are constraining what we could possibly win in healthcare, and really trying to move things in that way. And our central problem now is, what are we going to do when the Ford government decides that they're going to privatize the surgeries and diagnostics, right, in our hospitals, which is one of the last public not-for-profit parts of the health system. Or the rest, when they decide that they're going to close the LHINs down and privatize the remainder of home care. what are we going to do? How are we going to go to the wall? How are we going to stop them? How are we going to mount a campaign that's big enough, strong enough to actually stop them? And so we just had our assembly for this weekend, and that was the challenge. And we agreed that we would do public education capacity building all year and have a whole structure around that, and mass mobilizing. And when they come after the large sections of healthcare and try and privatize it, that we will coordinate mass mobilizations and escalating actions to the point that we stop them. That's what we agreed to do. And we didn't name what that was in terms of general strikes or what have you, because as you organize, people start to dream bigger. As you get bigger, people start to think bigger. And I think if we said general strike right now, we wouldn't be able to succeed in that in any way. We're not the labor movement. We need to work with them to do that. But we needed to challenge people, and people were overwhelmingly supportive of this. I just want to end. Do I have a few more minutes? Perfect. The models of organizing that we've used in the Health Coalition, I learned from the organizing that we did in the 1990s in the social justice, building the social justice coalitions, the anti-Harris coalitions, and I was the co-chair of the Kingston Day of Action, the community co-chair of the Kingston Day of Action. And so the model of organizing where the unions paired up, they called every single one of their members person by person by person. They talked them into going out on strike against their employer to put pressure on the state. And there was a 3 or 4 week campaign of media events virtually every day. So by the end of it, you owned the media. You had the front pages and all of the media in the community for weeks leading in. You created the debate in the community. And among the community sector, challenged the boards of the not-for-profits and so on to endorse and to support and to shut down in solidarity with the Day of Action and so on. That kind of model of organizing is the same model that we have used to build the referendums, town by town by town, that rolled back the P3s. And we also held a province-wide referendum, largely outside of Toronto, because we're weak in Toronto, but bigger in the smaller towns, to stop when the Liberals attempted to privatize the hospitals, the surgeries and succeeded in getting the Liberals to completely withdraw that plan. And so we're trying to use some of these models, some of these lessons that we learned from the mass mobilizations of the 1990s and bring them to bear today as we try to organize our communities and get people to dream bigger and insist that we not give ground in terms of allowing any further privatizations of the public healthcare system. In terms of building consensus around ideas for progressive reform, the way that we've done it so far, sector by sector, so we've done it in home care, we've done it in long-term care, we've done it now in the hospitals, is to hold public hearings across the province and roundtable meetings, to conduct interviews, like hundreds of interviews with different classifications of workers and health professionals and patients and so on, and pull all of the recommendations together into policy papers that give a kind of structure for progressive reform, and then consult on the policy papers and finalize and try and develop the broadest consensus that we can around models of progressive reform in healthcare. And so we're doing that right now, finishing it for the hospital sector and for the regional governance for healthcare, and we'll build consensus around that as the plan. It's sort of our antithetical plan to the Ernst & Young report that the Ford government just came out with. And so I think the major lessons that I learned from the organizing in the 1990s that we have brought to bear is that it is incredibly possible to organize people en masse. It's actually not even that difficult to do it. Most of the days of action were pulled off in 3 weeks in each community. 3 weeks, 3 to 4 weeks, with a number of people phoning through their locals and so on. That when we fight, we win. Almost always we win. Today, right now, the labor movement, labor leaders are telling themselves that the days of action didn't actually win anything, and it's not a model for today. And so, and I get that, you know, I don't believe that that's the exact model that we should use. But we can't deny that we actually did fundamentally change policy in the days of action. Hospitals, for example, you know, that cornerstone to the Harris government's approach was to cut hospitals dramatically. By 2000, they were increasing funding for hospitals by 12% per year. Like, we won a sea change in policy in the public service through the fight back in the 1990s. People don't really realize that by the height of the days of action, Mike Harris is down to the low 30s in the polls, the lowest he ever got. You know, that phoning every member for hundreds of thousands of members, town by town, actually did help to shift public opinion. Creating a visible fight back and a community presence showed people that there was a fight and they had to choose a side about it. That was really, I think, very important. And then the limitations. There were no clear demands, really. You know, it's sort of shocking that we won the reinvestment we did because no one was actually clearly demanding it. And that we didn't fight against things like the loss of the democratic hospital boards and things like that. And we've suffered for not fighting against those things afterwards. So I'm just going to end there and can sort of elaborate more with questions and answers. Thanks.
Finally, we have Jim Deutsch, who's a child psychiatrist here in Toronto and a member of Health Providers Against Poverty.
Okay, I'll stand as well. So thanks for having me here. So I'm on the steering committee of Health Providers Against Poverty. It's an organization that's been around for about 11 years. Louder. And one of the founders was Gary Block. There's Andrew Pinto, Ritika Goel, and back in June I spoke at the strategy meeting in place of Ritika Goel, who's quite busy with various things these days. We meet the first Wednesday of every month at the Workers' Action Center, and we've been involved in the 15 in Fairness campaign for quite a while. And we're also, we have a lot of overlap with the OHIP for All campaign, Canadian Doctors for Medicare, the Decent Work in Health. I'm on the Social Justice Committee in the Psychiatry Department, and I've been involved in the Critical Psychiatry Network, which is really looking at the fighting the incursion of the neoliberal model in psychiatry as well. In its effort to dehumanize individuals. We hearken back to the original concept of Medicare before Tommy Douglas had to go national and build alliances and make compromises. So that includes community health clinics, preventive measures, dental, pharmacare, and we look at the social determinants of health, including housing and their pathetic substitute, which is the shelter system. We look at food security and education as well. We apply a public health lens to the political and economic policy making, and this includes advocating for progressive taxation. We support workers' rights, and rights, not asks, as that's commonly used term these days. It really gets to me. We're not asking, and in fact, we're demanding, and these are needs. This isn't negotiable. These are actual needs that we deal with. Recently, we've seen the attack on the paid sick days, emergency leave, predictable hours for workers and families, and of course we support living wage and income security programs, including universal basic income and universal basic services, so you don't give one and take the other away. In terms of OHIP for All, I was in on the original meetings of that. I haven't been able to make their meetings more recently, but I keep up with the emails. They're going Canada-wide now. In Ontario, you may know that there are at least 500,000 uninsured people. These include people doing the 3-month wait when they come back to the country or move one province to another. refugees, temporary foreign workers. We advocate for a sanctuary province. And we found that arguing for longer-term savings past the next election cycle has not seemed so effective. We've been arguing this for years because all the data is there. And we advocate, particularly in terms of what do we do right now, we address the needs of marginalized persons, the maternal and pediatric sectors, and the timely cancer diagnosis and treatment, just for starters. Currently, it seems not to matter how many degrees one of us might have when we go to advocate at Queen's Park. And healthcare providers face a specific strategic issues, I think, in terms of not putting our clients or patients in any kind of harm's way should there be a general strike, although I think we support that definitely in principle. And I guess I'll just end and we can discuss more at the Q&A. What do we do now and how do we fight? Thanks.
And our final speaker is Michael Hurley. You are the first Vice President of QP Ontario. You are the head of OSHU. Michael Hurley.
Great. Thanks very much for coming, and thank you to the organizers of this event today. I'd like to talk just a bit about who we're organizing when we are organizing our members. So 85% of the healthcare workforce is female. Half of them are full-time, half of them are part-time. The average age is 50. They don't have the legal right to strike. They don't have the same right to refuse unsafe work. And I would say that there's a lot of focus on neoliberalism and loss of democracy in terms of policing and stuff, but really in the healthcare workforce, in the healthcare workplaces, there is a real lack of democracy. There is a abuse of discipline and of firing. These are workforces that are run and they live and work to some extent fearful. I think if you really looked at it, you'd find that it's kind of scary. And we had a nurse who was fired for speaking out. She said at a conference that there was a problem with violence in the hospital. She was a psychiatric nurse. They fired her. It took us 2 years to get her job back. She was reinstated. I give you that as an example. And when we do focus groups, which we've been doing on violence, it keeps coming up from the participants that everybody knows that this nurse was fired, and it resonates with everybody because their workplaces aren't too democratic either. These cuts that have been happening over 30 years, how has the healthcare system managed to keep itself together? It's relied upon the exploitation, and in particular the emotional exploitation of this workforce. These women are effectively coerced to do more with less and to try to paper over the holes in the system and try to keep it together for people. And it's just not possible, right? We have a lot more success when we aim this workforce at the state, the provincial government, over issues of funding or privatization than we do if we attempt to put it in conflict with their employers. It's just an interesting dynamic, I think. Like, we've had an illegal strike, but that was a long time ago, and what's happened between now and then has been a tremendous erosion of class consciousness, not just in the part of our membership, but across the working class. And people are not feeling powerful. Our members do not feel powerful. They don't feel like they're part of a worldwide movement that connects them and has a shared politics. They're like little islands, like everyone else, and that's an issue. I think we've been doing a lot of work on the issue of violence. I just want to talk about that for a second because it's interesting. 68% of our direct care staff were physically assaulted last year, 20% more than nine times, and 42% were sexually assaulted on the job. There are almost no consequences for any of this happening. And when we do focus groups, there's a tremendous reluctance to make the correlation between the huge tolerance for physical and sexual violence against women in society at large and what happens in our workplaces, which of course, being female dominated, are simply environments in which the normal practices that happen on the street happen in our workplaces. The same attitudes towards women, the same degradation, the same racism, the same sexism perpetuates itself in our workplaces. But people don't really want to see that. And our racialized members don't want to talk about it because they experience racism from their coworkers. I just think these are dynamics when we're talking about who we're organizing and how we organize them, right? And then in terms of the impact of the effect of neoliberalism, like we're not quite in the same place we were either 20 or 30 years ago. Like we have a labor movement which has embraced a trade deal. That's a dramatic shift from last time, but like 20, 30 years ago, Ernie and I would be in the same room, plotting about CUPE, and that stuff doesn't happen as much anymore. And there's been a real erosion of strategic thinking, of a willingness to take risks, of class consciousness on the part of the union leadership as well. They are nowhere where they were even just a few years ago. Not just here, all over, right? We shouldn't take any of this personally. These are all challenges. So for us, we have to organize. And to organize, we have to give people hope. Because no one is going to board a bus in a hopeless endeavor, right? They need to believe in it. They need to believe that they can make social change. They need to believe that the world can be better. They need to believe that they're defending socialized medicine and that stands for something. That stands for socialization against capital, or like the concentration of wealth in the hands of corporations and the wealthy, right? And a return to the good old days before public Medicare. They have to believe in that, and we have to mobilize them towards that. And one consequence of what has happened in neoliberalism is that the unions have become corporate, competitive and corporate, and obsessed with growth and with branding and with self-aggrandizement to position ourselves to capture greater market share. And yet the situation demands unity. It demands a common front. That's the only thing that will be successful. For our members in bargaining, when we could not achieve a collective agreement by ourselves, it was only natural to bargain at a common table in a common campaign with Unifor and SEIU, and doing that we were able to achieve a collective agreement. But this whole question of which fight is more important to the working class, fighting neoliberalism or fighting within the labor movement, is kind of a key question. And unfortunately, a lot of the labor movement is tied up on the wrong side of that question, chasing itself around this stuff, and we need to overcome that. What's coming at this workforce? Why would they be boarding the buses in these numbers? Because this government is talking about making $15 billion in cuts to a deficit, and they're talking about cutting corporate taxes by $7.5 billion, which translates for us, just in our sector, to 3,400 hospital beds that would have to be closed, and 16,000 hospital staff would have to be cut to make up those numbers, let alone what would be going on in other sectors. And this is happening at a time that the Ontario population will grow by 30% over the next 20 years, and it's going to age, and the number of seniors will double, the number of over 70s will triple, the number of over 90s will quadruple, and people know what's going to be happening in terms of the tidal wave of demand for services that their threadbare staff is supposed to meet. And they want to fight it, and they want to resist, but they need to be given hope for that. They need to be laid in front of them a strategy, which is a hopeful strategy. And that has to be about unity, and it has to be about mobilization. And it can't just be about stopping cuts. It's got to be about, we need to add capacity. We need to add capacity to meet those challenges in long-term care. We need to deal with the exploitation of the workers in the home care system. These women who are making $16 an hour with no guaranteed hours of work and no mileage, driving unpaid for hours in the country in unsafe situations to take care of people alone in their homes, right? Why do we put up with that? We need to give these people hope. We need to put in front of them a militant strategy, and that's why, of course, healthcare workers should really consider what our tactics would be with respect to a general strike. But certainly, I'm proud to say the entire CUPE Ontario Executive Board signed onto the letter that is in circulation, calling on political strikes if necessary to meet the challenges of what this government has planned for us. Because if the kind of motion that was passed at the Tory convention this weekend, which endorses and embraces the privatization of the delivery of healthcare, is what this government has in mind, then what would the workforce do to defend the public healthcare system? That's something that we have to put our minds to. So for us, we put extra effort. Louis over here is our prime organizer. He just spends a lot of his time visiting local to local, cajoling and encouraging and working with locals to get them to fill buses, and then to get them to do better the next time, and to get them to do better the time after that. And he was telling a story this morning about a local in Pembroke that started with 3 people, and it seemed like that wasn't much yield for a day spent going up to Pembroke, but now there were 20 of them on the bus. They only have 200 people in their workplace. Espanola, how many did we have? 30 on a bus out of 120 people came down to Toronto for that rally. But we can do better than that. What are we doing it for, though? We need to talk about adding capacity and building this socialized system of healthcare. That's what it's got to be about, because that's what gives people hope that on their work unit that they will be able to cope with this crushing workload that is beating them down and making their lives a misery. These men go home, they're broken physically, and they're crying in their cars when as they're leaving because of the guilt and because of the exhaustion of working in this system, which has been cheated and starved of funding. And it isn't just the Tories, it's been the Liberals, it's been the NDP. This is a 30-year progression of cuts in real terms that have been raining down on the healthcare system. So when we mobilize people, we've got to talk to them about a future where that doesn't happen, where patients are not turned away, where they're not living on stretchers, where they're not dying in hallways without dignity, without any privacy with their families. We've got to talk about a system in which the worker is respected, where they're not subject to violence, where they have basic human rights. We've got to talk about that stuff. We've got to talk about a vision of the future where we stand in front of them and we say we're leading them somewhere, and that somewhere is not just for us, but it's somewhere for everybody. That's what we got to do.